Our conversation today is on the coronavirus and what it could mean for access to healthcare and coverage for people across the state of Wisconsin and maybe beyond. I'm Brenda McBride of ABC for Health, and I'm joined with Bobby Peterson, also of ABC for Health. And Bobby, you've been thinking about this a lot in terms of what it means for Wisconsin when we have a threat of this variety.
Right. I think it's something that we know is an imminent threat. We've seen what's happened in other countries, China, Italy, Iran, starting to break here in this country. And I think it's really important for us to get ahead of it. It's an imminent threat to the public health of Wisconsin. We need to think about how can we best protect people in our state? How can we promote access to coverage and services, access to testing, and making sure people are connected to the services that they need. There's things we can do to help mitigate this from the get-go, but I think it's going to take legislative leadership, executive branch leadership, and the people of Wisconsin coming together, and public health leadership.
Right. You've characterized this as, first of all, this is not a political issue. This is a bipartisan issue.
It's a moral issue.
It's a moral issue.
Yeah, I mean, it's doing the right thing. And I think we look too often at political bickering, infighting, finger pointing. Now is the time to rally together around an issue, protecting the health of the public, protecting Wisconsin, and doing the right thing for the people, making sure they get connected to all the services that they need. I think the alternative is pretty startling and scary. If we look at what could be looming, is a lot of people that lack coverage, lack funding to pay for treatment, and you have opportunities for things like the coronavirus to spread and to become broader than it really needs to. Now, some people might say this is politicizing this issue. Absolutely not. I think this is really a moral issue, and we need to think about this in those terms. How are we going to help people? We have the opportunity to expand Medicaid.
Yeah.
We have the opportunity for additional federal funds to come in. We have offsets of state GPR funds. This is really a rare opportunity for us to really catalyze around an issue and make sure we can help as many people as possible, use our funding efficiently, and save GPR funds for other emerging public health issues that occur.
And you've gone so far as to call on the governor. When you say executive leadership, you call on Governor Evers to expand Medicaid so we can meet this.
Well, Governor Evers can't do it by himself, but he can call a special session, and we need the legislature and the governor to come together around this type of expansion. We really can't dilly-dally. We need to move forward with this. It's something that I think the people need. I think the people expect it. The people expect adults in the room and to move forward with common sense items that are going to expand funding, protect the health of the public, and make sure we're all protected in the meantime.
And that would that kind of expansion, like you said, could draw on federal funds. It would then free up some of that general purpose revenue, that GPR, to adjust and be flexible should we need it in those areas. What else can Wisconsin do in terms of access to care and coverage along these lines?
Well, I mean, I think it has to be outreach and education because people need to know that we're expanding these services. I'm hoping that we do. But we also need to make sure that we get to hard-to-reach populations, or rather, populations that are hard for us to reach. Minority populations, culturally distinct populations, the homeless population, that this could be a devastating outbreak within homeless communities that are camping out under bridges and not getting the care that they need. So there's some targeted efforts that we need to get involved in here to really help people. And people think this notion of bipartisanship is a bit of a panacea. Well, we just saw it at the federal level. President Trump signed an $8.3 billion initiative that was strongly bipartisan. We need to extend that same level of bipartisanship here in Wisconsin. Move beyond the petty bickering and get something done for the people of Wisconsin.
Is it possible?
Hey, roll the dice. I mean, I think that stranger things have happened, but I think we need to get the public behind it.
Yeah.
And politicians react to the public. So it's important for the public health community to speak up strongly about how important this is. Not to alarm people, but to alert them to the opportunities and how we can help one another in the best way possible.
We can serve more people. We can afford to do that. And the last thing we want is someone to say, I never went to the doctor because I didn't think I could afford it.
Yeah, and I think if the legislators don't listen, there's a day of reckoning. It's called Election Day on November 3rd. And I think, people might remember that you didn't step up.
Yeah, how did you step at a time of need? Yeah. Thank you, Bobby.
You're welcome.